All right. Hey, thanks everybody for being patient with us through our technical difficulties, and we hope this is working. Can everybody hear me? Wave your hand if you can hear me. All right. Looks like everybody. Great. Before we start tonight, I'd like to just take a minute and say something and, um, and to address the community. I'm sure by now most of you are aware of the incident that took place at my home over the weekend. I will not go into the details about the event. What has happened? Please give me a minute. I am very ashamed of because I love my family and this community very much. I'm taking full responsibility for my actions. I'm already working on things to start the healing process for my family. I ask that you please give us space and allow us to work on this so we can get back to a better place and mend our hearts. As for my position as mayor, I plan to stay and continue to do the things that great leaders are expected to do. With so much going on, I believe that I need to continue the effort with council and staff in keeping our community safe, healthy, and finding ways to secure our financial future and prepare for recovery. The council is going to have to make some tough decisions, and we will get through this. The last thing that I ask is that you please let due process happen for me as you would expect for what you would want it for you. Thank you for allowing me to say that. At this time, I would like to give the floor to any council members that would like to make any comments or statements if they wish.
Mayor, I would like to, on a personal note, I have really come to the conclusion in your years as mayor that even if people don't agree with everything that you've done, it probably has been the most unselfish thing I've seen in my life. It's certainly one of the most unselfish, because I know your heart has really been there for the city. And I would just plead with people that this is not the time for vigilante justice. I think that we do need to give the Hillman family time to work through their personal issues. And these are family issues. And we could really use a lot of input from the citizens. I think the mayor is going to provide good leadership even through this trying time. And I have a lot of faith in city council as well. I think the world of the member of the city council. And I'm a bit of a historian. I think this town has not seen a personal tragedy on the, town-wide probably since 1918 Spanish flu. Unfortunately, when the mayor mentions tough choices, I think we're also going to compound the Spanish flu type of event with a serious recession, if not a 1929 style depression. I worry that many of our businesses may never open again. I'm not under any illusion that this is going to be over quickly. We may be dealing with this for a long time, and we really need solidarity and leadership at this point in time, like we haven't seen in 100 years. We're going to have to try to get through this with like maybe 20 cents on the dollar, 30 cents on the dollar. I'm not a gloom and doomer. I mean, all you have to do is look at Colorado Boulevard, and you know that we're going to be in dire economic straits. And it really is mission impossible to try to run a city, on 25 cents on the dollar. So it's going to be something that I think every citizen of this town is going to feel. Without a doubt, everybody's going to be affected by this. And I would just encourage folks that hear this to consider that this is a time for solidarity and to work as a team to try to get the town through this. And I really think that we have probably tried to accomplish more in the last 5 years than we have in the last 50 years. And now, you know, folks need to know that because of the recall effort and its sensitivity, I believe that staff, the mayor, and council are probably focused like a laser beam on listening to people. I think I can't stress that enough. And if you look at the elimination of light study and the establishment of the parking review panel, that's just living proof that we are listening. And I just want to end this with, you know, a request for solidarity and also a request to give the Hillman family some time to heal. That's all, and thank you for listening.
Thank you, Chuck.
I agree with Chuck. You know, it's going to be tough. We don't need this infighting. I had citizens tell me they're tired of all this back and forth. We need to get together as a group. This community is going to really hurt with loss of businesses, income, revenues, and we're going to need to figure out how to, as Chuck said, solidarity, get it together and heal and work together for the betterment of the community. And I think everybody's doing a good job on council. I think the staff's doing a great job. I'm worried about how we're going to pay them. I'm worried how we're going to pay for anything if we don't start getting some income coming in. And so I'm just asking the community to come together, work as a team, and do what we can do.
Thank you, John.
This is Art. I can't add much to what was said. I think everything was said very eloquently and right on the button. I think we definitely have developed to the, hopefully developing to the citizens that we're a group of integrity. We want to maintain that. And I think, like both said, we need to let the mayor's family go on and mend this on their own. If there are questions or recommendations, I hope that the citizens will come forward in a very professional way and ask questions or maybe suggest some good ideas as far as the financial end of what's coming. You know, a lot of heads sometimes are better than a few, and we're open to hearing sound financial recommendations. And everybody's right. I don't think this is going to get over quickly. And like Chuck, I don't want to say like a doomsdayer, but I think it will get back over time. And we have to be prudent with what we decide and how we decide things, and not be reckless and go forward. And I think we have a group like in City Hall that is excellent, and the council as well. And I think we have the ability, the intelligence, the patience, and the understanding what we need to do. That's all I have to say.
Thank you, Arthur.
Short, huh, guys? You're welcome.
Where's Bob? Bob. You got Bob on there? Yeah. Bob? You there, Bob?
Can you hear me?
Yeah, now we can.
I know the image, I'm assuming, is not on there. Very briefly, wanted to say I thought the mayor's statement was very clear, and there's really not much to comment on that. The community's big challenge is going to be making intelligent decisions when we are finally allowed to begin to move forward. Right now is a planning stage, and that's why we need the input from the community, residents and businesses both. Without any further belaboring of that issue, I'm looking forward to making the most intelligent moves we can when we're able to make some decisions for ourselves. And we're so much at the end of a string right now, like every other community in the country, that we just need to be ready to pounce when the opportunity is there. So that's all. And Mike, thank you for your statement. I thought it was very clear and
Thank you,
appreciate it.
Bob. Scott?
Yeah, I think we need to allow the Hillmans some space and have due process. I don't think there's anything more to say on that. And I think we just need to focus forward and, listen to the citizens and figure out what we're doing going forward with this current pandemic.
Thank you, Scott. Is that it? Jim?
I agree with Scott, and I have nothing positive to say. I don't know if this is about the future of our town, our Idaho Springs town, or if it's about the events that took place. There's a lot on my mind. I've discussed them with you personally, Andy, as well. I guess I don't know where the question is because everybody kind of diverted that. Whether this was about the events that took place
Either one.
over the weekend or, how bad the economy is because of the pandemic. So I'm really kind of confused there.
If you want to speak about your position on me remaining mayor, would be fine.
I in the early stages of this, I thought it would be appropriate that you would probably resign. Anybody else in any department head would do so. Like I understand the process. I understand all that. As far as my position, I'm not sure that I feel 100% comfortable with everything. It's not how I run my family. I'm not judging, placing blame or any of the sorts. That's pretty much my take on that. My integrity means a lot to me, and it means a lot to the people that voted me into this office, to a chair, an honorable chair at the dais. Don't want my constituents to view me as just another person that thinks that behavior is tolerable or acceptable. I'm not 100% sure that this is the time or place to probably talk about all the details or whatever it is. And I do believe in due process. And I believe that you and your family definitely deserve and need the space that is going to be given to you. As far as the other picture of it is, how do we move forward with this mess of the entire city? I mean, that is a very, very big concern moving forward with this. But just because of this problem with the pandemic doesn't excuse the actions that were taken Friday night. And maybe I'm the only one that sees it this way and not looking into the future of whatever, but as a leader, you're our leader. And that's a hard thing to follow when our leader conducts himself in the way that you did. It's hard to stand right behind and say, we're on board, at least for me. And that's all I have.
Okay, thank you, Jim.
Thank you.
All right. We allowed all the council to speak. Now we'll get into what this public forum is, what it was meant for. We came here and it's designed to basically answer mostly we're going to probably be talking about the COVID-19 pandemic. We can talk about developments or any other community interest that the folks that have dialed in tonight to be able to ask. So with that, what we're going to do is we're going to start with Suzanne. We're going to start. Is that what we're going to do, Suzanne? We're going to get Suzanne to give us an update and hopefully give us some information about the governor's changes that he made it today. All right, you're on, Suzanne.
Unmuting, sorry. You think I have this down by now. Yeah, thank you. Thank you for inviting me. Folks that don't know me, I'm Suzanne Bosch. I've been with the county about a year. I'm the County Emergency Management Coordinator. What I've been doing is helping to coordinate on the county level what we were calling our incident management team and our incident command structure. We have shifted recently into a unified command emergency operations structure. The point of that is to demonstrate that we have certain people in certain roles across the county, helping to follow the incident command system, and we're using, we have someone on point for ordering all the personal protective equipment that we need. We've been having struggles with that, but we've gotten some support from the state and from Jefferson County recently, so we hope we're on board with that. We've been doing a lot of public messaging to talk about safety precautions, any of the governor's executive orders and what they might mean, talking about the good that's happening in the community, and keeping folks updated on what our command team is doing. We've also been having daily phone calls with this team. As you know, the information has been coming fast and furious, and we're trying to keep up with all of it and what it means for the county in order to either implement orders or decide what we can do to help the county. We have been, so on our morning calls, we've had, the sheriff's office and the EMS to get a good idea of kind of the status of our first responders. That has been our county's priority for providing the PPE, the masks, so that they can continue to serve the community. We're now starting to look at, as the governor issued an order last Friday about folks in businesses to to be able to, that they really need to wear face coverings, as well. And we're still encouraging, folks to stay at home and as much as possible and only go out for essential activities. Now, we know today the governor relaxed that, well, not today. He talked about how April 26th is his, which is Sunday, is the end of the stay-at-home order, but he's looking at, the gradual relaxing of that. He's calling it safer at home order, and it focuses on moving forward with maintaining 60 to 65% social distancing. And we're waiting, he was mentioning that he has guidance, he's developing guidance on that, or the state is, about what that means. So that's what the county is going to be looking at, is what does 60 to 65% mean? Is that what we want to do in Clear Creek County? Is that, do we need to go lower or higher depending on what the situation looks like in the county? And as you know, I'll let Cindy talk about our public health aspects, but our public and environmental health team has been working very diligently to make sure that we don't have outbreaks in our county, and monitoring folks. And monitoring folks, what that means public health wise is checking up on their symptomology, finding out how they're doing, how they're feeling each day, and seeing if symptoms are lessening or getting worse, and then addressing that. So that's what monitoring means. We've been providing personal protective equipment, to the food donations and distribution effort that's going on, with Troy Erickson, with the Veterans Coalition. We know that's been a amazing, positive, helpful activity that is being done. It's helping a lot of people in this community, and the community is really coming together to provide those donations of food, of money, so that we can continue to serve the community in that way. So as far as the public health specific actions, I will let Cindy Dickin talk about that, unless if there's anything else you'd like me to talk about, or if you want to have any questions now.
Do you have enough test kits for the coronavirus and for the antibodies? I mean, probably not, but do you know when they'll be here?
Yeah, we like most other counties across the state and the country do not have enough tests to do what we need to do in order to test everyone in the county to find out where we're at. It's an unfortunate reality of what's happening. And we did, I'm going to take some of Cindy's thunder away. We did receive 100 test kits today from the state. That's a very positive action. We continue to request more, but like the personal protective equipment, it just isn't available to us. And we're trying every method that we can come up with to figure out how to get this testing. We're also developing plans for, as soon as we do get the capability to do countywide testing, that we can open our, drive-through points of dispensing in order to get that out to everyone and conduct that in a public health focused, safe manner. So we're working very hard on those plans, as well as plans to manage any outbreaks that might occur. So there's an awful lot of planning going on behind the scenes that isn't necessarily talked about so much, but that's what our public health folks are working diligently for. So I wish I had a better answer for you, but that is the reality.
Thank you.
Hello. Do we
Sorry,
want
I had a question, and that was, can you tell me about how long it's taking to get the indication of the test back? Because I had been hearing like a week or more in some cases.
Yeah, that I'll have to defer to either Cindy or Charlotte to answer that specific question.
If Cindy's on, I'd prefer she answer that for Crystal.
Cindy, can you hear us? Cindy, are you there?
But I'm not sure if she can hear us or not.
I'll provide the best answer that I can. And so I'm the environmental health specialist. I'm not the public health nurse. So last that I had heard, we are on state phone calls twice a week with the state health department and their epidemiology team and their lab experts. Right now, it's taking anywhere from about 3 to 5 days for those results to get back to the county. If in a lot of cases, if people go through their primary care providers or they go through the hospital, they do find out sooner. But if they go through the public health agency, we administer the test, we have to take it down to the lab. It typically takes a few days for that to get processed, and then another day for it to get put in their database for us to be notified on the results. So we typically are around, I would say 72 hours is when we know.
Thank you.
Cindy, can they hear me?
Yeah, I don't.
Cindy, can you hear us? I guess we don't have Cindy.
She logged in.
Okay. Katie?
I'll remind Cindy to call in if that's a possibility for her where she's at, to see if she can provide us some information.
Okay. All right. Anything else from the county council? Do we have any questions for Charlotte or Suzanne? Okay, we'll see how to get Cindy on. So the city every morning for the last few weeks have been meeting at 9 o'clock. We sit around a table and compare notes and update the changes that we present to the city. Usually it's about an hour, a little over an hour. So we're doing our best to make sure that we can keep the community updated on what's going on, what's changing, what the city is planning on doing, and how we're moving forward. You can always find that information. We put it together, and then the chief posts it to Facebook and website and everything that has to do with us getting the information out to the community. Katie, are you there?
Hi, friends. Can you hear me?
Yeah.
Cool.
Like give an
Hi.
update and kind of guide us through of what your role is and what you've been doing and the information that you provide us for us to help base our decisions on.
Sure. So I'm serving in a volunteer role for the city as emergency management specialist, and really a lot of my role is just kind of liaising with folks and making sure that people are connected. One thing that I've been working on recently with the city, which we're really hoping anyone who is listening and watching can weigh in with their perspective on this. We put out an anonymous community impact survey, and this is not a health survey. It's a wider range of how you're being impacted right now as a result of the pandemic. And we're hoping that this information can really help us understand a little bit more about what's going on with you guys, what kind of the key issues are that are happening in our community, and how the city can focus our attention accordingly. So it's anonymous. You can find it on the city's website on the COVID-19 tab, and please fill it out. Please, please, please. We want to hear from you.
Is that all you have for us, Katie?
That's all I got.
All right. Also, there's another survey that's being circulated throughout the community. This is put on by CML, and this is more on businesses in the city and how they have been affected. And gathering that information is going to be a statewide, and then they'll base it and they'll dial it down to areas and counties and probably even cities to really give us some good data on the circumstances that have happened and what we've been doing and how we're addressing them and how we move forward. You know, we know that the big elephant in the room is going to be the recovery effort. You know, once we start being able to open stores, move around the community more, and make sure that the last thing we want is a reinfection and, you know, all of a sudden we start spiking again in our community. Let's see, Cindy's still not on? Still don't have Cindy.
She said she's logged in.
If you want, I can just provide a really brief little update about the environmental health piece of it and some of our facilities and opening up and how that's going to work, just to till Cindy can get on. But Governor Polis's press conference that he just did at 3:30 today, when he talked about the Safe at Home or Safer at Home initiative and shifting from stay at home, he did roll out some examples of what to expect for opening businesses back up. So it does seem like within the next few weeks, there are going to be options for retail fronts. Not entirely certain about dining rooms of restaurant facilities, but some other non-essential, non-critical businesses can start opening back up, and they're rolling that out. We do have a phone call scheduled for this week to talk about the recovery process from the environmental health perspective and how to work with our businesses to make sure that's done in a safe and effective way. We're also working closely with the state health department. I don't know how many people are aware, but our retail food program is actually managed by the state health department. We used to inspect the restaurants locally, but that was cut when we had staff cuts in our department. So the state manages all of our childcare inspections, retail food establishment inspections, and school and camp inspections. So we have a phone call scheduled with them this week and next week to talk to them about the recovery process and how to best roll this out for Clear Creek County in a safe way, and to get an idea of what the governor has in mind for restaurants and things like that. So we are working very closely with those partners at the state level to make sure we're doing everything we can for our business owners as well as the community. So just wanted to provide that update.
Thank you, Charlotte. Public safety, chief, you got something? Can't hear you.
I can't,
There
I'm
you go.
talking, Kara's in the kitchen saying, hey, unmute it. They can't hear you. So we are doing fine. We haven't lost any officers to any exposures. Everybody is following safety protocols. We have seen a significant drop in calls for service, primarily because of the closure of the interstate. But the types of calls that we normally get, in the city, we're still getting. Occasionally, we do get some hot calls. So everybody's on their game. Everybody knows that they have to use some extra precautions. I thought it would have happened sooner, but we did have one of the dispensaries broken into Friday. I was expecting it to be one of the liquor stores. The proprietors responded very promptly, and they're following our guidance on how to make that building more secure. And we'll be visiting with the other proprietors of the kinds of shops that we would categorize as high risk or high value. So all in all, things are going good with the police department. We continue to get support and give support to the sheriff's department. So I want to thank Sheriff Albers for keeping his resources available to us. I'd also like to compliment Suzanne, you and your operation, Charlotte, Cindy, and Katie, because you're behind the scenes, but you are really being saddled with the brunt of what's going on here. One of the things I want to brag about really quickly is the county, in cooperation with the Veterans Coalition, did get food distribution and collection up really, relatively fast compared to other cities. One of the things we got off the rack right away, chiefly because of Katie, is the No One Goes Hungry campaign, where we were distributing cases of soup to not only citizens of Idaho Springs, but folks out in the county as well. I'd like to thank the department heads, the police department staff, and others who actually contributed and funded this. We couldn't have gotten this out so quickly without the help of Mr. Hillman and the wildfire. We were able to use the power of wholesale commercial purchase to get those cases here pretty quick. And that's all I have.
All right, thanks, Chief.
I did get a update from Cindy that she's on, but she's muted, not from her end. She says from the other end. So if someone can maybe check and see if that's an issue.
Cindy, did it take care of the issue, what I just did there?
That's weird.
I do see a muted
Muted.
icon
There you go.
on there.
Now what is it? Now, Cindy? Hello, Cindy? Still don't. Can Cindy hear us, Suzanne?
I can ask her. Oh, she's responding to me right now. She can't hear you.
She can hear us, but we can't hear her.
It says that you're unmuted, Cindy.
I'm sorry?
Same thing.
Yeah, that's you had, yeah.
Well,
So I would like to put out a special thanks to the Helping Hands and what they have done. I believe they took the first step in starting getting things together to provide for the needs of the community. Special thanks out to the Elks for hosting and allowing the Veterans Coalition to set up over there and being a part of that to gather and take in some food for the community. Also, it's amazing of some of the vendors that donated some products, and sometimes it was a pretty large supply of products for us to distribute throughout the community. So thanks to everybody that has been a part of that and will continue to be a part of that. I don't know if we're gonna get Cindy. Why don't you call her on the phone? Can we put it up to is there any way if she's on the phone that We're gonna call Cindy on the phone and put her close to a microphone.
She just texted me and she said she's been screaming into her phone, but we can't hear her. So I don't know what's going on.
We
but
can actually hear from her house.
there you go.
Council, do you have any questions so far?
Hello, you are live.
You're live. We got you on the phone,
That's-
Cindy. So
we
you
can
might
hear
want to
you.
speak up a little bit. I'm going to hold you closer to the mic here.
Okay,
All right.
I am so sorry. I'm not sure what the problem was, but hey, I'm sure it was on our end. So,
We're just kind of waiting, wanting to hear an update from you and any information that you'd like to provide to the community.
sure. I don't know whether you all talked about the short-term rentals or about working with hotels and motels. Environmental health is and I are going to be providing some guidance to the owners, operators of the hotels and motels. And it's just about guidance as far as cleaning a room using the CDC standards for cleaning and disinfecting, actually, guest rooms, so that when one guest leaves and another guest arrives, they are relatively certain that they are going to be checking into a room that is clean and has little or no residue from the guest that left, and hoping this will cut down on any potential risk that there might be as far as transmission of the virus.
Hey,
So,
Cindy, is that for hotels, mostly for hotels or short-term rentals?
So we have guidance for the short-term rentals, but it's my understanding Idaho Springs has closed their short-term rentals and their owner-operated rentals. And so what we're providing is for the motels that still do rent for 1 and 2 night stays. The hotels were exempt from the order, and Idaho Springs has a number of individuals, families who have who call the hotels their permanent residence. We also know that you have construction workers who are providing a service to the city and to the county, and so those rentals obviously are exempt as well. So what we were trying to do is to provide some guidance to those hotel rooms that remain open and available for guests to check into, regardless of the length of stay. But we just wanted to make sure that they were clean and that we didn't what was not clean was not left in the rooms. And so everybody is assured of a good night's stay and not leaving with something they didn't arrive with.
I got a question for you, Cindy. In the hotel rooms, or the virus itself, and with the hotel rooms, you say that so right after they leave, the room can be cleaned and then somebody else could come in? Or are we asking for a 24, 48, or 72 hour in between re-rental?
We are asking that, according to CDC standards, that the room remain vacant, closed for 24 hours before the housekeeper is allowed to go in and clean the room. And we have put together a list of cleaning standards and disinfecting standards that we are going to give to you for your perusal, and then we'd like to be able to present to the hotels and motels and speak with the owner operator or the general manager or whomever is responsible for cleaning the rooms, the common areas of the hotel, the restrooms, if they are in the common areas, and talking about registration desks, every solid surface or every surface that the germs might linger on. And so we're just as an effort to try to keep everyone safe when they come to our fair city.
All right. Council, do we have any questions for Cindy?
Yeah, I do. How are we verifying that these cleaning procedures and all of what Cindy was kind enough to explain are actually being implemented?
Did you hear that, Cindy?
No, I didn't. I'm sorry.
John, repeat it.
The question was, how do we ensure that these procedures that we are asking them to implement are being followed?
So my hope is that when we present the guidelines and the list of cleaning supplies, that we are able to speak with housekeepers as well as the general manager or the administrative staff and talk about how important it is. And, you know, I'm hopeful that if we think that might be necessary, it's just knowing how long it takes to have an encounter. I want to just know that when someone comes and stays in Idaho Springs or wherever in the county, in a hotel or a motel, that we've done the very best job we can to protect the people that are staying with us. We don't want them to leave with and be sick from something they experienced while they were staying with us.
Okay. Any other questions, council? All right, great. Okay, last chance for any of our panelists or council to give any more information or ask questions.
I guess the question I have is, this is first I heard about the governor possibly implementing a safer at home rather than having to stay home. As a county or as a city, are we obligated to change it if he designates so, or can we stick with a more stringent rule if we really care to protect everyone? Can we stick with the more rigid, with the first rule rather than the second, which I think is kind of lackadaisical, but that's just my opinion.
Yeah.
Suzanne?
Oh, sorry. Yeah, I was going to say I can answer that. The counties are always able to, or counties and jurisdictions are always able to implement more strict rules or orders than the state if they wish. So something that, we're looking at county level, obviously we're starting to look at, long-term recovery, as you guys noted, that's a very important piece of this, but starting to look forward as now we know what the governor's safer at home order is going to be, that the stay at home order will not be extended, at least as of today. Situation could change. But now that we know that, we're really trying to plan, at the county level for what that might look like in the county and all the public health aspects that we need to take into consideration. As I'm not sure who mentioned it earlier, but absolutely we need to make sure, or as much as we can, that there's not a new big cluster outbreak anywhere in the county, because then we'll have to do some other measures in order to bring that back down again. So that's what the county is looking at as far as what might what would this governor's order mean for us, and how would it be implemented safely, in coordination with each of our jurisdictions, so that we can have input from each jurisdiction in order to make sure that we're doing this in a way that everyone can support as much as possible. As you mentioned earlier, these are very, very difficult choices. And it's, there's not a lot of easy answers for this.
Yeah, Cindy?
Oh yeah, when Suzanne's done, I just want to say something
Okay,
about that.
no problem.
So I was just saying that there's, absolutely no easy answers. And, things change so fast that
Right.
we're trying to keep up with all the decisions that need to be made in order to serve the county countywide and serve our community. Cindy, did you have something you wanted to say?
Yep, Cindy has something to say. Go ahead,
Thank
Cindy.
you.
Yeah, I just wanted to say, opening this county or any county, lifting the order to stay at home was a pretty complex decision. However, this afternoon, the governor kind of set a path for us to follow as the stay-at-home order is going to expire. But guidance for staying at home remains somewhat restricted, especially for those individuals who are 65 or older, because they are strongly cautioned to continue to maintain social distancing and stay at home whenever possible. Because the truth is, we can't afford during this particular time to have outbreaks in the state of Colorado or here in Clear Creek. One of the factors that drove the decision to relax the stay-at-home order was the number of urgent care beds available at our hospitals and the absolute need to give our citizens a way to earn a living while we evaluate risk, and to constantly be aware of the fact that, in effect, we are juxtaposing the health and well-being of our citizens kind of against the need for businesses to open, visitors to return to our county, and, as I said, for our citizens to go back to work. It's going to be difficult because our COVID numbers are low. Clear Creek has managed to keep our population safe and healthy because we effectively sent everyone home or out of the county when we closed the county courthouse and county workspace. And I think going forward, the citizens of this county, we're going to have to rely on our mayors, our city council members, and our commissioners to constantly evaluate the recommendations that the Public and Environmental Health Department will provide. This is a strange time. Actually, it's what might be called the collective we time, because we need to make these decisions by first evaluating what are the risks that we are imposing on our citizens when we begin to open our borders, the shops, the restaurants, the bars, the county roads, recreation areas, so on and so on, just so that we can allow visitors back in. And so I guess I would like to say that I'm looking forward to being able to engage in these conversations, and with the help of the public and environmental health staff, I hope we can help our elected officials make some decisions that are really in the best interest of our citizens. So I hope we can going forward.
All right.
Thanks.
Thank you, Cindy, very much for your comments. Okay. Anybody else? All right. I'm sorry.
I think Art might have had
Art, did you have something else?
Yeah, I did, and I first of all I appreciate the input of both the young ladies, very intelligent comments and what have you. I just hope that we just don't jump on the bandwagon, that possibly we may stagger some of us following, let's say, the safe at home rule a little bit, maybe staggering it and not implementing it the first day that the governor says it can be implemented, to see what goes on in other areas and be a little watchful and be a little cautious. That's just my personality, is being cautious, but I think in this situation, because someone says something, even though he is the leader of the state, sometimes we're better off listening to the scientists, researchers, and the doctors who are not trying to implement the opening of the businesses, but implement the safety of the citizens of the country as well as our little community here. So I just hope that we take all that into consideration, because sometimes you let the cat out of the bag and it's very difficult to get it back in. So that's all my comments. But I do appreciate what the lady said, because both of the young ladies very, very well said. I understand where they're coming from, but I just wanted to throw that in, and I thank you for that opportunity.
All right. So we do have some public questions that we're gonna to put out there.
I was gonna say, if we want to just mention that they could send us,
Anybody that's on can send us to John's.
email me, jkane@idahospringsco.com, or if you're in the call, you can also post your question in the question and answer section of the chat, and we'll get them answered.
Very good. So do we have any questions already, John, by email or
We
anything?
haven't had any asks yet.
None? Pre-ask or current ask?
There's nothing to this point for either one.
All right. Since we don't have any questions from the public, I don't think that I have anything else. I think that we've covered quite a bit of detail today or this evening. Again, we will continue to keep our community here in Idaho Springs informed. A word that we're kicking around here is when we have our meetings, thanks to Katie, of course, community resilience, the ability of a community to work together collectively to find solutions through challenges like this. And I really firmly believe that's what we're doing. We are a resilient community, and we will get past and we'll get by this.
Mike, if you have questions that come in later on, please forward them to us and we will do our best to answer.
Okay, sounds good.
We have a couple of questions.
Oh, got a couple of questions coming in.
Oh, Randy Murphy had just said, thank you all for your time and information.
Okay, thank you, Brandon.
And then we have one person who had raised their hand in the chat. Is there speaking, or do you want them to send the questions?
Send the question.
Yeah.
No, they can speak. That'd be fine.
All right, Amanda, I'm going to be unmuting you in about 2 seconds, and you're unmuted.
Amanda? Hello? Amanda, can you hear us? Have her go ahead and send it in.
Are you there? Thanks, Mike, very much. And thanks to all the council members. We appreciate the opportunity.
Absolutely. Thank you, Cindy.
Can we try this one more time
Yeah.
here?
Hello? Sorry, this is Mike. Are you guys there? I used her phone because I'm not the technical guy.
Gotcha. All right, you are unmuted, sir.
I'm with you? All right, thank you. No, I just, I was a little concerned in regards to the meeting start. I mean, obviously, I wanted to come on today and congratulate the mayor on a win in the recall election. I know that nothing was stated about that. And I guess as citizens move forward, we talk about moving forward and putting things past us here, and I'm a little bit concerned about the lingering effects of those private issues that might be going forward. You know, the due process is true and it's right and it should be there, but I worry that the media is going to try to take advantage of that every time that long process takes course and goes through its proceedings. So, how does that affect, people's perception on the city of Idaho Springs moving forward as we get through the pandemic? I know that, we primarily have safety concerns on our minds right now, but I do have, genuine concerns about that just from a logistical standpoint as a business owner and a citizen in this town. A little bit more on a personal note, in watching just the overall pass through, and I'm trying to not be in a negative way, but I have 4 daughters and they watch the news, and we try to look to you guys as community leaders and role models, and giving the community's recent events. I'm not even sure 100% how I should respond to my children on how their view should be of our city and our city council. So I guess that's all I have to say, but just kind of food for thought. moving forward. And I'm not trying to be a Weisenheimer or a negative person, but I think there's a lot of concern in that regard. And I don't 100% know the answer, and I know it's a sensitive time, and I'm not trying to be negative, but it is a question that I have. So I guess thank you for your time.
All right. Thank you, Mike. Anybody else, John?
Charlotte just had put it in the chat. I think everyone can see it who's in the chat, but for those who might be watching on YouTube or on our open media platform, if you have any questions about environmental active public health orders, feel free to email champson@clearcreekcounty.us. I will post that on the city website and on our Facebook page just so everybody has access to that email address for any questions about environmental or public health.
Okay, if we have any more questions, John?
I might have one on my phone here. Nope.
All right. Okay, we don't have any more questions. Again, thank you, panelists, council, all the participants that are on and listening, and Mike for your comments. And we will keep everybody up to date.
Thanks, Mike.
Thank you.
Thanks, Andy.
Thank you.
Thank you.